Hello, welcome to Midtown Community Health Center Diabetes Educational Videos. My name is Sadie Rivera and I'm a dietitian and diabetes educator for the clinic. Today we're going to be talking about physical activity and diabetes. Why is it so important and how can we implement in our daily routine? I first want to mention the definition of physical activity and sedentary behaviors. First, we have that all movements that increase energy use, that's physical activity. Exercise is more structured activity to help with physical fitness, like aerobic, resistance, or flexibility exercises. By other hand, you have sedentary behavior, so it's when we sit, reclining, or lying posture. Some benefits of physical activity, and these are the most important one for diabetes, is that it lowers cholesterol, lowers stress and anxiety, lowers blood sugar. It also improves with mood, so we feel better when we exercise, improves blood pressure, and help with weight management. Here is a list of other health benefits of physical activity: reducing the risk of dementia, type 2 diabetes complication, some type of cancer like bladder, breast, colon, kidney. Also help with reducing the risk of excessive weight gain, specifically working with maintenance. Gestational diabetes, postpartum depression, and fall-related injuries in older adults are great benefits of physical activity by reducing the risk of all these. It also improves sleep, perceived quality of life, and in the young children, it helps with the health of the bone and the weight management. Guidance of physical activity. How much should we be doing? 150 to 300 minutes per week. If we do more vigorous activities, half of that, 75 to 150 minutes per week. Very important that we do 2 to 3 sessions a week of resistant exercises, not on consecutive day. For example, if on Monday you do Zumba, on Tuesday you can do like a 20-minute walk and a session of resistant exercise with free weights or other resistant activities that we'll be discussing. Also, flexibility and balance training. It helps with balance and strength of muscles and bones. We should be doing that 2 to 3 times a week also. Breaking the cycle of sedentary behavior by getting up and move every 30 minutes for those that sit for a long period of time. Let's review really quick. One way you can do to increase your activity is to do it 10 minutes at a time, minimum of 30 minutes every day, most of the days of the week. And don't let 2 days go by without exercising. One example, in the morning you can do 10 minutes of stretches. If you go for a 10-minute walk after your lunch and after your dinners, and at bedtime, if you do a little bit of yoga, meditation, or stretches, 5 to 10 minutes, they all add up, and then you have 30, 40 minutes in a day. Safety first. Want to make sure you talk to your doctor to make sure you're clear to start or continue doing physical activity. If the activity is uncomfortable or painful at any time, please stop it. It's very important, like with any exercise, you warm up before the exercise and cool down when you're done exercising. Something I miss here is that make sure you're wearing appropriate shoe. So we want to make sure that it's comfortable, that it fits well, and it's not too tight. If you're at risk of hypoglycemia, meaning that your sugar can go down during the exercise, this can happen if you are on insulin or if you take other medication that lowers blood sugar. Check your blood sugar before exercising. If it's under 90, have next to you, or maybe consider taking a serving of a carbohydrate, 10 to 15 grams, and this is like a cup of milk, a small fresh fruit, a slice of wheat bread, and have the glucose pills available in case you start feeling like a low. Have 2 to 4 of those pills. Now let's go over some activity moderate activity. Walking, swimming, cycling if it's less than 10 miles per hour, power yoga, dancing like ballroom or line dancing, general yard work at home. If you have a garden, working on it really helps you moving. Or exercise classes like water aerobics, those are great examples of moderate activity. Vigorous intensity, it means higher intensity like jogging or running, swimming laps, more vigorous dancing like a Zumba with a higher impact, cycling faster than 10 miles per hour, jumping the rope, working harder in your yard like digging or shoveling, that will increase your heart rate much more. Hiking uphill or with a heavy backpack. There are other routines of high intensity interval training that can count as vigorous too. Or other exercise classes like step aerobics or kickboxing. Here I'm showing some pictures of exercise, resistant exercise that you can use with the stretch bands, the exercise ball, the free weights. Even while sitting, you can do stretches and resistant. You're using your own body weight or some resistant weight to work your muscles and bones. Also flexibility exercises to stretch, and that will help with balance as well. The physical activity pyramid, if you can see here, we can focus on the bottom of it. Every day we should be doing these activities. And then at the very top of the pyramid, we can see what we can cut down on. More watching TV, computer games, eating for more than 30 minutes at a time, cut down on those. The final message, talk to your medical provider or diabetes educator for specific precautions in the presence of diabetes-related health complications. Choose an activity that you enjoy and vary the activities you do. So if you do Zumba today, tomorrow go for a walk, later you can try water aerobics, etc. And make it fun. Take your dog, invite a family or a friend, and do this that you can keep doing it on a lifetime like a lifestyle activity. If you have any question, you can call Midtown or call my number at 801-334-1335. Thank you.